Welcome to the Dr. Izzy's Medical Podcast channel.
Squamous cell carcinoma. Squamous cell carcinomas, also known as epidermoid carcinomas, comprise a number of different types of cancer that result from squamous cells. These cells form on the surface of the skin, on the lining of hollow organs in the body, and on the lining of the respiratory and digestive tracts. Common types include squamous cell skin cancer, a type of skin cancer. Squamous cell carcinoma of the lung, a type of lung cancer. Squamous cell thyroid carcinoma, a type of thyroid cancer. Esophageal squamous cell carcinoma, a type of esophageal cancer. Squamous cell carcinoma of the vagina, a type of vaginal cancer. By body locations in squamous cell carcinoma. Human papillomavirus infection has been associated with squamous cell carcinomas of the oropharynx, lung, fingers, and anogenital region. Head and neck cancer. About 90% of cases of head and neck cancer, cancer of the mouth, nasal cavity, nasopharynx, throat and associated structures, are due to squamous cell carcinoma. Thyroid and squamous cell carcinomas. Primary squamous cell thyroid carcinoma shows an aggressive biological phenotype resulting in poor prognosis for patients. Esophagus and squamous cell carcinomas. Esophageal cancer may be due to either esophageal squamous cell carcinoma or adenocarcinoma. Squamous cell carcinomas tend to occur closer to the mouth, while adenocarcinomas occur closer to the stomach. Dysphagia and painful swallowing are common initial symptoms. If the disease is localized, surgical removal of the affected esophagus may offer the possibility of a cure. If the disease has spread, chemotherapy and radiotherapy are commonly used. Lung and squamous cell carcinomas. When associated with the lung, it is typically a centrally located large cell cancer, non-small cell lung cancer. It often has a paraneoplastic syndrome causing ectopic production of parathyroid hormone-related protein, resulting in hypercalcemia, but paraneoplastic syndrome is more commonly associated with small cell lung cancer. It is primarily due to smoking. Penis and squamous cell carcinomas. Human papillomavirus, HPV, primarily HPV 16 and 18, are strongly implicated in the development of squamous cell carcinoma of the penis. 3 carcinomas in situ are associated with squamous cell carcinomas of the penis. Bowen's disease presents as leukoplakia on the shaft. Around a third of cases progress to squamous cell carcinoma. Erythroplasia of Carotte, a variation of Bowen's disease, presents as erythroplakia on the glands. Bonoid papulosis, which histologically resembles Bowen disease, presents as reddish papules. Prostate and squamous cell carcinomas. When associated with the prostate, squamous cell carcinoma is very aggressive in nature. It is difficult to detect as no increase in prostate-specific antigen levels is seen, meaning that the cancer is often diagnosed at an advanced stage. Vagina, cervix and squamous cell carcinomas. Vaginal SCC spreads slowly and usually stays near the vagina, but may spread to the lungs and liver. This is the most common type of vaginal cancer. Bladder and squamous cell carcinomas. Most bladder cancer is transitional cell, but bladder cancer associated with schistosomiasis is often squamous cell carcinomas. Diagnosis of squamous cell carcinoma. Medical history, physical examination and medical imaging may suggest a squamous cell carcinoma, but a biopsy for histopathology generally establishes the diagnosis. TP63 staining is the main histological marker for squamous cell carcinoma. In addition, TP63 is an essential transcription factor to establish squamous cell identity. Classification. Cancer can be considered a very large and exceptionally heterogeneous family of malignant diseases, with squamous cell carcinomas comprising one of the largest subsets. All squamous cell carcinoma lesions are thought to begin via the repeated, uncontrolled division of cancer stem cells of epithelial lineage or characteristics. Squamous cell carcinomas arise from squamous cells, which are flat cells that line many areas of the body. Accumulation of these cancer cells causes a microscopic focus of abnormal cells that are, at least initially, locally confined within the specific tissue in which the progenitor cell resided. This condition is called squamous cell carcinoma in situ, and it is diagnosed when the tumor has not yet penetrated the basement membrane or other delimiting structure to invade adjacent tissues. Once the lesion has grown and progressed to the point where it has breached, penetrated, and infiltrated adjacent structures, it is referred to as invasive squamous cell carcinoma. Once a carcinoma becomes invasive, it is able to spread to other organs and cause the formation of a metastasis, or secondary tumor. Tissue of origin. The International Classification of Diseases for Oncology system lists a number of morphological subtypes and variants of malignant squamous cell neoplasms, including papillary thyroid carcinoma, verrucous squamous cell carcinoma, papillary squamous cell carcinoma, squamous cell carcinoma, large cell keratinizing squamous cell carcinoma, large cell non-keratinizing squamous cell carcinoma, small cell keratinizing squamous cell carcinoma, spindle cell squamous cell carcinoma. It is also known as spindle cell carcinoma, and is a subtype characterized by spindle-shaped atypical cells. Adenoid, pseudoglandular squamous cell carcinoma, intraepidermal squamous cell carcinoma, lymphoepithelial carcinoma. Other variants of squamous cell carcinomas are recognized under other systems, such as keratoacanthoma. Other histopathologic subtypes. Erythroplasia of Carotte. Marjolins ulcer is a type of squamous cell carcinoma that arises from a non-healing ulcer or burn wound. More recent evidence, however, suggests that genetic differences exist between squamous cell carcinoma and Marjolins ulcer, which were previously underappreciated. One method of classifying squamous cell carcinomas is by their appearance under microscope. Subtypes may include adenoid squamous cell carcinoma, also known as pseudoglandular squamous cell carcinoma, is characterized by a tubular microscopic pattern and keratinocyte acantholysis. Basaloid squamous cell carcinoma is characterized by a predilection for the tongue base. Clear cell squamous cell carcinoma, also known as clear cell carcinoma of the skin, is characterized by keratinocytes that appear clear as a result of hydropic swelling. Signet ring cell squamous cell carcinoma is a histological variant characterized by concentric rings composed of keratin and large vacuoles corresponding to markedly dilated endoplasmic reticulum. These vacuoles grow to such an extent that they radically displace the cell nucleus toward the cell membrane, giving the cell a distinctive superficial resemblance to a signet ring when viewed under a microscope. Prevention. Studies have found evidences for an association between diet and skin cancers, including squamous cell carcinoma. The consumption of high-fat dairy foods increases squamous cell carcinoma tumor risk in people with previous skin cancer. Green leafy vegetables may help prevent development of subsequent squamous cell carcinoma, and multiple studies found that raw vegetables and fruits are significantly protective against squamous cell carcinoma risk. On the other hand, consumption of whole milk, yogurt, and cheese may increase squamous cell carcinoma risk in susceptible people. In addition, meat and fat dietary pattern can increase the risk of squamous cell carcinoma in people without a history of squamous cell carcinoma, but the association is again more prominent in people with a history of skin cancer. Tobacco smoking and a dietary pattern characterized by high beer and liquor intake also increase the risk of squamous cell carcinoma significantly.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.